Hi everyone, welcome to the Community Classroom with Dr. Tracey McCarthy, psychologist, attorney, and educator. Many believe that borderline personality disorder is rare. It is not. It is a common disorder addressed in clinical settings due to the complex and distressing nature of the disorder. It overlaps with other disorders, and that makes it difficult to completely tease out what is going on with the individual. Many also believe that this disorder is a female-only disorder. That is also not true. Some frequently believe that borderline personality disorder is also the same in some sort of way as narcissistic personality disorder and psychopathy. Now, while manipulating and idealizing and devaluing may be seen in both types of individuals, the person with borderline personality disorder tends to do these things out of desperation versus a need for domination and ruination of a targeted person. And so it is also a myth that nothing works to address borderline symptoms. As with other difficult to treat disorders, multisystemic therapies and certain behavioral therapies tend to hold promise for addressing borderline personality disorders for individuals who are actually motivated to change. So today we're going to discuss borderline personality disorder to address misinformation and misperceptions with respect to what this psychological challenge actually is and what it is not. So let's clear up some important diagnostic points first. Okay, first of all, it's important to know that a personality disorder, any personality disorder, is essentially a long-standing, maladaptive, and inflexible pattern of inner experience that the person is having and behavior that leads to significant impairment in life functioning, whether it's social functioning, academic functioning, occupational functioning. Now, with respect to borderline personality disorder, it involves a pervasive pattern of instability of interpersonal relationships, also instability in terms of self-image and affect or emotional expression, and marked impulsivity. And this begins early in adulthood and presents in a variety of contexts. I personally believe that it actually begins a lot earlier than early adulthood, but we can discuss that in a later video. Okay, so borderline personality disorder is indicated diagnostically by having at least 5 out of the 9 following symptoms that I'm going to share with you. Okay, so number 1 is frantic efforts to avoid either real or imagined abandonment. And, this would happen if the person suddenly initiated an intimate relationship with someone, whether it was physical or emotional, or cutting off communication with someone in anticipation of being abandoned by that person. So the person basically exhibits some attachment challenges, either attaching indiscriminately and too quickly, or basically putting up really solid walls and boundaries to keep people out of fear of actually being abandoned. So it's almost a preventative kind of strategy that many of them come up with in order to deal with issues related to abandonment. Okay, so number 2 is a pattern of intense and unstable relationships. And these relationships can be with family members, with friends, other loved ones, co-workers. Individuals with borderline personality disorder, they often swing from extremes of feeling very close and loving, and they're idealizing the person, to extreme dislike or anger towards the person. And this happens really quickly. It can happen very rapidly, like within seconds or minutes. And so then there's also identity disturbance. And this is manifested in markedly and persistently distorted and unstable self-image or sense of self, a person's self-worth and self-esteem, and just their idea of who they are. This vacillates pretty rapidly with individuals with borderline personality disorder. Another characteristic is number 4, which would be impulsivity. And so you're looking for impulsivity in at least 2 areas that are potentially self-damaging, and they tend to be pretty dangerous. So, you might see things such as spending sprees, engaging in unsafe sex, Lots of substance abuse, reckless driving, binge eating, purging. Now, what you want to do is you want to tease out whether or not these behaviors are occurring primarily during a period of elevated mood or high energy. And the reason you want to do that is because that would indicate that the person might be suffering from bipolar disorder, not simply borderline personality disorder. So that's one of those diagnostic issues that really need to be teased out because it can get very confusing and very murky. Okay, another issue that you might see is recurring suicidal behavior, gestures or threats, or self-harming behaviors such as cutting. Now, sometimes people tend to think that the suicidal gestures are simply manipulative and that the person doesn't mean it, and that would be a wrong assumption. Oftentimes when a person with borderline personality disorder initiates a suicidal gesture, they mean it. And so it needs to be taken seriously, even in the face of the other dynamics that might indicate that the person is being manipulative. Okay, number 6 would be affective instability or emotional instability due to high reactivity. So the person may exhibit, really intense episodes of sadness, irritability, or anxiety. And these episodes can last for hours, all day sometimes. It's rare that it would last for like a week or, several days, but, it's sort of a cycling in and out, and it's pretty rapid and pretty intense. Okay, number 7, chronic feelings of emptiness. This is where the individual pretty much feels, just empty. They feel void, and they feel, they have a very difficult time with trying to have a sense of being filled up. And so it's a feeling of numbness. And so you can imagine you've got these episodes of sadness and irritability, and with some individuals also, marked feelings of emptiness. And this might be happening pretty rapidly. Another symptom, which would be number 8, that also looks like bipolar disorder, and so again, you need to be very careful with this, is that there may be inappropriate and intense outbursts of anger, uncontrolled rage, frequent displays of all sorts of temper tantrums, chronic physical fights that the individual might get into. And again, that looks very similar to bipolar disorder. One of the most important characteristics diagnostically that you need to be on the lookout for would be transient stress-related paranoid ideation or dissociative symptoms. You need to be very, very careful when you see that. Basically, these are psychotic symptoms. So you might see some transient psychotic symptoms in response to intense experiences of stress and distress. Now, there are some associated features with borderline personality disorder that you need to be mindful of. And one is a major one, is there's frequently self-sabotage. Okay, so the individual will sabotage all sorts of life goals, academic goals, career goals, healthy, stable relationships. So, before they can even be successful, they may do things to sabotage themselves to prevent themselves from actually being successful, almost like a fear of success. Other associated features, which I mentioned before, are psychotic symptomatology, and this can include hallucination. So seeing things, hearing things, feeling things that other people can't see, feel, or hear. Also, recurrent job loss. So, there's a frequent losing of jobs because of these symptomatic dynamics that I just discussed. Also, relationship loss. It's very difficult for them to hold on to and maintain healthy relationships. Now, individuals with borderline personality disorder also tend to have a history of childhood trauma. This is not to say that childhood trauma causes borderline personality disorder, because of course you have lots of people who have childhood trauma and they don't end up with borderline personality disorder, but there is a correlation, meaning that they coexist. You often will see that individuals with borderline personality disorder also have a history of childhood trauma. Now, there are some co-occurring disorders in adulthood that you need to be mindful of with borderline personality disorder. They almost go hand in hand, and you need to sometimes tease them out and make sure you're not dealing with one versus the other, because sometimes, we diagnose entirely too quickly. And so we need to make sure that we are seeing what we think we are seeing. When you hear hoofbeats, it's not always a horse. Okay, so some of those disorders are major depressive disorder, as I mentioned before, bipolar disorder, substance-related disorders, and PTSD, which would go along with the issue of childhood trauma. So it's a very complicated form of PTSD that a number of individuals with borderline personality disorder are dealing with. Now, I'm just going to give you my take on a few things clinically related to some other correlations. When you see an individual with borderline personality disorder, or if you are a person with borderline personality disorder, you might remember having feelings of separation anxiety in childhood. If you look up these symptoms of reactive attachment disorder in childhood, you also might see, a past history of some of those symptoms. Another thing that you might see is depression in childhood. Now, let me clarify something. Depression in childhood and adolescence does not necessarily look exactly like it looks in adulthood. And so with children, what you'll often see, which often gets misdiagnosed, is you'll see irritability and anger, and that's their way of expressing depression, acting out. And so children who are depressed often get punished for being depressed versus treated. And it's a very complicated issue. And ADHD may be noted more frequently in those who go on to develop borderline personality disorder also. Now, we tend to believe that symptoms of borderline personality disorder are lifelong, just like other personality disorders. But there's some good news, and that is that solid and tailored intervention may work for many individuals with borderline personality disorder, and they can go on to achieve great relational and vocational stability as they move through their 30s and into their 40s. Now, there's some differential diagnostic issues that need to be considered with borderline personality disorder. Now, what I want to talk about is this issue of conflation, and this happens a lot where people will be talking about one thing but naming it something else. Okay, so there's an increasing conflation that I've noticed in people's conversations between borderline personality and narcissistic personality disorder and antisocial personality disorder. And again, borderline personality disorder tends toward manipulation, but it's not to acquire profit or power or material possessions. They're trying to acquire care and concern and attachment to them. Now, with respect to narcissistic personality disorder, narcissists don't tend to have the symptoms of like self-destruction that is found in borderline personality disorder. And they also tend to have a bit more stable sense of who they are, in terms of, their self. Okay, so this provides a concise look at the basic diagnostic criteria and considerations for understanding borderline personality disorder. We hope this information was helpful, and we welcome your questions and comments in the comments section. Remember, knowledge is power. See you soon.